using critical thinking and technology for patient assessment. Medicine is rapidly changing. Every day we're finding new treatments, we're finding new diseases, we're finding new ways to assess our patients. Are you ready for this ever-changing world? What you need to focus on is how to integrate new technology with your experience and the knowledge that you already have. The base foundation of patient care is the ability to actually assess your patient without using technology as your foundation. It should enhance your assessment, not dictate what's going on with your patient. You need to perform your own assessment. Patients don't read the textbook. They don't understand that if they have a heart attack, this is how they should present. Their body is going to do something completely off the wall, and we're not going to be ready for it. In your primary assessment, assessing those ABCs, looking for life threats, you should always conduct that without technology. Create a list of differential diagnoses, anything that it could possibly be, and then use the assessment tools, the technology, in order to narrow those differentials down to your working diagnosis. When using technology, critical thinking is absolutely vital. You need to look at whatever reading you're getting and say, does this make sense? Does the patient really have this condition, or is there something wrong with the technology that I'm using? Clinical applications. So, for example, you're called to a rural road for a snowmobile accident. You have one patient who has an isolated fracture of the right tib fib. Your patient is complaining of 6 out of 10 pain and has present pedal pulses. Current vitals, blood pressure is 128/88, pulse is 120, respiratory rate of 18, and an SpO2 reading of 83%. Does this make sense for your patient? First and foremost, look at the patient. Don't take the reading on the machine as exactly what's going on. With an SpO2 reading of 83, we'd expect certain clinical presentations in our patient. Are they short of breath? Are they complaining of shortness of breath? This patient in particular is not tachypnic. The patient doesn't have labored respers. The patient is not cyanotic. All of those factors indicating that the patient is not suffering from hypoxia. The patient appears to be in pain based on the picture, but he doesn't appear short of breath. So that reading, probably not very accurate. Why? SpO2 measured the amount of saturated hemoglobin in the blood. It doesn't really tell you what it's measuring. It's just, is that hemoglobin bound to something? We would prefer it to be oxygen, of course, but even high levels of carbon monoxide can cause a high SpO2 reading. This one's reading low. In order for that reading to be accurate, there has to be adequate blood flow to the fingertips. In cold weather, or when somebody has nail polish on their fingernails, your reading's not going to be as accurate because blood flow is obstructed from actually reaching the sensor. Any other instances of technological mismatch? It could be that you're looking at an EKG and you're seeing ST segment elevation right at the J point. Your patient's not complaining of chest pain. Your patient is young and healthy, no congenital defects. Why? Some variant in cultures, such as African Americans, have what's called early repolarization, causing that J point to elevate. How would you know if that was significant or not? Look for your reciprocal changes. Just because the machine says that something's there doesn't necessarily mean it's clinically significant for your patient. Technology is changing how we meet the needs of our patients, how we assess, how we treat. It's fast-paced, it's amazing, but don't forget that technology is only one tool. It's not the only tool necessary for patient assessment. Your ability to critical think is far more important than any of the technology that you'll use.